This week on Wheelie Good Tips, we're talking about pain. For 20 years, almost 20 years, I've worked in the area of spinal cord injury impairment. But for 35 years, I have always worked in pain. Well, the first thing about pain is we can't measure it. And that's the really difficult concept for health practitioners to grapple with. We can't measure it. We can't measure it like you measure cholesterol or blood pressure or your oximetry, your oxygen levels, and get numbers out. And if we could, I think pain would be managed a lot better than what it is at the moment. The types of pain there are, well, we tend to talk about neuropathic pain, which is pain related to nerve damage. And the other type is nociceptive pain. In other words, damage to structures of the body, like joints, and in particular when you're dealing with people who are using wheelchairs, is damage to the shoulder. Pain wears you down and it affects you in both functionally, what you can do, your relationships, how you sleep, and it's just all-encompassing.
I'm Johnny, C4 tetraplegic. Pain is a massive secondary complication that I have to deal with in my life. There's many adjectives you can use to describe pain, from the literal things like burning, tingling, freezing. It's unmotivating, it's distracting, it's encompassing, it's all-consuming, and it takes your focus away from life in general.
Pain affects energy levels, I would have thought mainly because of disrupted sleep, and your batteries are not recharged. It draws our attention away from what we want to do, and that's tiring.
My pain is like an internal pain, and it's mainly in my butt area.
When you're experiencing really severe pain, I find you're really withdrawn. So you're there and it feels like the world's miles away. Your family and friends and the rest of the world is way over there and you can't get there. So when you can manage your pain and stay on top of it, you reduce that gap, and all of a sudden you're back in the world with people and friends. And that's really important.
What are the common ways to treat pain? I guess there are four categories, I would say. There are medications, so there are prescription medicines. There are non-prescription medicines, so there are drugs that are both legal and illegal that are used. There is surgery, so there are certain types of pain condition, such as an arthritic hip, where a joint replacement is a magnificent way of producing pain relief. Then you've got physical ways of managing, and physiotherapy, often by some of their physical techniques of maybe manipulation and certain massaging techniques, which are beyond the realm of physiotherapy, can be of benefit. And then the final aspect, and probably not in this order, is the psychological, and using techniques of distraction, relaxation, to help people cope with their pain symptoms.
This morning was a good example. I got up, I had a bit of pain, and it was just one of those times that you know it's there and you're just really conscious of it. So I've got a project on at the moment. So I came in here and had a paint, and by the time that you turned up, it's gone. You know, I'm only worried about the painting itself, not worried about anything else. I'm not even worried about it. I'm just in the painting. Totally takes my mind off the pain.
The prescription medicines are often described as a ladder. In other words, you start with the most innocuous medicine at the lower rung and working your way up to the potent heavyweight pain relievers. And the heavyweight pain relievers are the opioids or the morphine related medicines, and they come with issues. But in terms of prescription medicines, I mean, we talk of paracetamol, the anti-inflammatories, and all those medicines can be obtained through the supermarket. Then you get on to the medicines that may have other effects, such as anti-epileptic medicines, and gabapentin is probably the most common and widely understood medicine, and used a lot in people with spinal cord injury. So anti-epileptic medicines are used. Some of the benzodiazepine, so the Valium type medicines, can be of benefit in certain pain conditions, but they come at a price of sedation. Interestingly, an article recently looked at the analgesic effect of alcohol. Now, alcohol is not a prescription medicine, and we know the harm of alcohol, but some people do use alcohol to provide a pain-relieving effect. And then it's the opioids are probably the class of medicine that is challenging medical practitioners at the moment, because we know what's happening in America and the States with misuse of OxyContin, misuse of heroin, which is freely available in that country. And the downside of the opioids in a high dose is respiratory arrest and death. But opioids, in the context of people with spinal cord injury, the problem is the effect on the bowel and constipation. So everyone who takes an opioid generally has some degree of constipation. There are people who take opioids and they feel yuck. But there are some people who take opioids and gain a useful effect. What you don't want to see with opioids is escalating dosage, so that you just keep climbing up the dose and not gaining a useful effect. So we've got to be careful with opioid medication, prescription medicines. It's intriguing as to what medicines work for some people and not for others. And we as doctors can't look at a person and say, oh, your spinal cord injury is at a certain level, you're a certain age, you're a certain gender, therefore this drug will work. And it doesn't happen that way. So everyone is different. So it's an exploration and not having fixed ideas about the medicines. And it may be that a dose of 300 milligrams of gabapentin will work for a person who was ex-rugby player, and 2,700 milligrams may only just work for a little old lady of 80 who weighs 45 kilograms. So everyone is different. I think distraction is very important, but it's very hard to maintain distraction for 24 hours. But certainly distraction, relaxation, doing an activity that you enjoy can often have an effect on the quality and the severity of pain.
The worst pain I experience is in the morning when I wake up, and then I find a shower. Hot water really helps, because I get musculoskeletal pain and also neuropathic pain. So musculoskeletal pain in my shoulders, then neuropathic pain in the paralysed areas of my body, which is a really, really weird thing, because it's where you're paralysed, but it's where you feel the worst pain. So a shower helps, arnica creams, things like that, massage, stretching, and also being occupied. If my mind's occupied, I don't feel as much pain. If I'm working, if I'm interacting with my family, if I'm inspired about something, if I'm doing activities, if I'm reading, if I'm watching documentaries, I find all of those things keeps me occupied and not thinking about my pain.
You then get into that whole area of the use of cannabis and its complex role, its complex effects on us as humans. sadly in this country, it remains an illegal product. And so only in some very specific areas can it be used, and we talk about multiple sclerosis. But in terms of spinal cord injury, it is not legal to use cannabis. And yet we know that people with spinal cord injury do use it and can use it with effect. I would never promote its use as a smoked joint. We know the harms of smoking, and also the delivery of the medication can be challenging. So what I'm talking about is the cannabis and the cannabis oils, and in particular the CBD, which is one of the main cannabinoids. It can be effective. It seems to be recognised as relatively low in terms of adverse effects. So I have conversations with patients about the use of cannabis and cannabinoids, and we know that in other countries it is legal and it is used, and it can be very useful in pain and spasticity and general well-being. So that's another area to explore, but obviously it remains illegal. The incidence of pain in spinal cord injury is probably in excess of 60%. So 6 out of 10 people with a spinal cord injury have significant pain in their daily life. That's enormous.
Pain is such an individual thing. You have to work out your own strategies that work, and it's often a combination of the two. And in terms of medication or behavioural strategies, it's doing things that take the edge off, but without clouding your mind, or without doing things that are going to occupy too much of your time, so that you can just get on and enjoy life.
Thank you for watching Wheelie Good Tips this week on pain. If you want more advice, that can be sought through the New Zealand Spinal Trust. I'm available 24 hours a day. No, I jest, but I do have a keen interest in people's welfare who have significant pain.